My name is Michael Joseph. I'm an emergency medicine resident at the University of Connecticut. I will be presenting the EPIC point-of-care ultrasound workflow solution developed under Ultrasound Director, Dr. Meghan Herbst. There are no financial conflicts of interest to disclose. Quick background, ultrasound is an integral part of the practice of modern emergency medicine. Here are the core applications as delineated by FACEP. Ultrasound at the bedside has been shown to improve patient safety, time to diagnosis, clinical management, resource utilization, and patient satisfaction in multiple studies. There are highly variable systems across EDs across the country for documentation and storage of ultrasound information. FACEP does recommend recording video clips with interpretation and documentation in the medical record. Some systems are as simple as performing the bedside ultrasound, recording the clips, and documenting interpretation locally on the machine. Other systems may have integration with the picture archiving and communication system, or PACS, which does typically communicate with the electronic medical record. This facilitates transparency as consultants can view images and improves patient care. Third-party software developers such as QPath have developed middleware which can integrate these multiple systems. These facilitate interpretation documentation, as you can document all findings at a workstation after performing the exam. It does improve quality assurance and credentialing, as all images, provider details, and patient details are kept together. And finally, it does facilitate education for residents and medical students. The system in place at the University of Connecticut prior to July 2019 was one of the fully integrated PACS and EMR that did not have any form of communication with the ultrasound. Ultrasounds were performed and all information stored, recorded locally and stored in a database. However, the purpose of this workflow was to fully integrate these two systems. So in words, the purpose objective was to create an ultrasound workflow through EPIC without utilizing a third-party vendor that promotes uninterrupted performance, seamless documentation, storage in our PACS, integrated billing, and a transparent QA process. So for methods, you simply select an order for imaging, just like any other imaging performed by radiology. Sign the order, and upon signing the order, two things happen. One, the order is sent to the ultrasound machine in a work list. In addition, patient information is set to the inbox of the ultrasound director to facilitate video review and quality assurance. So for example, from the view of the ultrasound machine, you will select Query to look at a list of studies that have been ordered, where you can see the patient name, for example, here, chest tube, POCUS, and ID. You perform the scan at the bedside, recording all clips and end exam, and that is all you have to do at the bedside. Once you return to your workstation, you will fill out a procedure note. There's a list of diagnostic procedures to select from, and you can choose one or more. For example, if you performed both a cardiac and thoracic ultrasound exam, you will select the smart forms for both of these. Here, a bladder exam was performed. For all scans, the indication must be typed in manually. However, the smart forms do have the information required to be documented that is within the scope of emergency medicine. For example, post-forward residual for a bladder scan. There's always additional room for additional commentary. If you're a credential provider, there's additional forms that need to be filled out where, for example, you need to indicate whether or not the ultrasound meets quality guidelines, the accuracy of your interpretation, and whether or not the scan meets minimum criteria for billing. Once signed, the note appears as a procedure note, which can be viewed by all consulting and future providers, and also all imaging can be visualized in PACS via hyperlink within the note. As I mentioned before, after signing an order, the director's inbox is populated where quality review can be performed. Notes are addended and indicated whether there's agreement with this credential form. And finally, any additional comments can be made. For example, here on the ultrasound of the bladder, indicates that it is adequate, true positive, it does not meet criteria for billing, and there's additional commentary that there's urinary retention with echogenic mass in the bladder. So the results in the initial 10 months since implementation from August 2019 to June 2020, there was 1,623 POCUS exams performed, which was approximately 50% increase from the time period prior to implementation of this workflow. About 3.4% of these exams had missing information, compared to over 70% were missing information prior to implementation. And this information included 5 key things: patient name, scan indication, interpretation, imaging, and provider name. So over 70% of scans prior to this were missing one of those. There were 8 newly credentialed attendings, and there was a total of 26 additional credentialed exams across all attendings. And finally, approximately 37.8% were submitted for billing. Limitations of this study is that it was performed without third-party vendor via Epic in consultation with hospital IT and radiology. If you don't have Epic, this may be a different process. And of course, there's always barriers to implementation that are typically system specific. So we recommend involving all interested parties from the outset. In summary, we developed a formalized EMR-based workflow without third-party vendor that improves patient care and communication, quality assurance, education and credentialing, and billing.